Welcome back. This time next week, on July the 19th, the nation will take its biggest step yet back to normality as many of the COVID restrictions that have blighted our lives for the past 16 months are axed. But while the dark days of the rule of six may be behind us, from Monday, Health Secretary Sajid Javid has urged the clinically vulnerable to avoid indoor settings and unvaccinated people during this new phase of what he calls continued caution. Doomsday Professor Chris Whitty then doubled down, saying that all unnecessary meetings should be avoided.
And so, we are dealing with uncertainty, and the Prime Minister and ministers are having to make difficult decisions with uncertainty as part of the decision process. In terms of wearing a mask, I would wear a mask under three situations, and I would do so particularly at this point when the epidemic is clearly significant and rising. And the first is in any situation which was indoors and crowded or indoors with close proximity to other people. And that is because masks help protect other people. This is a thing we do to protect other people, as it's by far its principal aim. The second situation I do it is if I was required to, by any competent authority, I would have no hesitation about doing that, and I would consider that was a reasonable and sensible thing if they had good reasons to do that. And the third reason is if someone else was uncomfortable if I did not wear a mask, as a point of common courtesy, of course I would wear a mask. So under all those circumstances, I would do so.
That messaging, as well as Boris Johnson's urging in his national address this afternoon to keep thinking of others and consider the risk, could spook folk into rejecting the freedoms returned to them and split families and friends as a public treated with kid gloves is forced to assess what they are personally comfortable with. So, should we continue to limit social contact after Freedom Day? Microbiologist Professor Sally Jane Cutler from the University of East London says we need to show restraint and limit who we hug. But Tory MP Mark Harper, chair of the COVID recovery group, is fearful that the government's timid approach to reopening and reliance on flawed data could pave the way for another lockdown. They both join me now. So, Mark, what on earth are we meant to think today? We get our freedoms back on Monday, but then you've got the Prime Minister saying, if you're a good citizen, don't embrace freedom in too much of a hurry. What does it mean?
Well, look, I think my view has been quite consistent through this, which is the key thing is vaccinating those that are vulnerable to COVID, and that's directly tied to people's age and health condition. And the fact is we started with the most vulnerable, so we've already vaccinated with 2 doses or offered a vaccine to everybody in those vulnerable groups who account for 99% of those who've died through the pandemic and over 80% of those that have been hospitalised. Those groups have been protected, and we're rapidly moving down the age profile. So once you've dealt with that massive reduction in risk of serious disease and hospitalisation and death, which we have done, then you then get a disease which has some risk attached to it, and there's never going to be no risk. This disease is going to be with us forever. You then have to learn how to live with it and manage it going forward, like we do with other diseases. And anybody that says you now, having vaccinated the vulnerable, you can't proceed, is effectively saying you're going to have restrictions forever. And I just don't think that's a very realistic proposition. We've got to learn how to judge risk for ourselves and learn to live with it as we do with many things in life, not just diseases, but all sorts of risks we take as we live our lives every day.
Professor Cutler, isn't that a fair point from Mark Harper? There's two choices here.
Yeah, well, I think really the important thing that he didn't mention is that word balance. And I think it's really got to be a phrase that was used in the announcements that were made earlier this evening, was that balancing of risks. And so this is why we don't just drop all the restraints and the restrictions in one go. We need to ease ourselves back into normal life, and we need to do it gradually.
How?
If we do it quickly,
have been doing it gradually.
Well, you say how? I think really we know how. We know a lot of the ways to actually reduce the transmission, the community transmission that we're seeing. At the moment, look at those graphs, look at those increasing cases that we're seeing. A lot of that's driven in people that are not fully vaccinated, a lot of our young adults, and a lot of young adults are choosing not to get vaccinated as well. Look at the slowdown in the vaccination rollout that's happened over the last few weeks since we've been targeting the 20-year-olds because they're not engaging with it as much as the older adults in the population. So we're putting all our reliance onto the vaccines. And yet we know we've got these other tools in our arsenal that we can use to help reduce this transmission that's going on at the moment.
But Mark, isn't the issue that those other tools destroy businesses? They destroy the economy and they destroy people's livelihoods and mental health.
Well, look,
well, I can tell you how. Sorry to interrupt, Mark, and actually you can go into it a bit more. But there are actual statistics, aren't there, Mark, that now say if we have to continue to wear masks, it will actually decimate certain parts of the hospitality industry.
Well, let me just pick up the argument. So I was listening very carefully to what Professor said. So on the point about transmission and cases, of course, before we vaccinated people, cases were incredibly important because they led directly to hospitalisations and deaths. But actually, we have now severely weakened the link between cases, hospitalisations and deaths, and we're seeing very low rate of death, particularly amongst those who've been vaccinated. And it's working. 2/3 of the people who are in hospital with COVID are people who haven't been vaccinated. So, the vaccines are working. If we're going to continue focusing on cases, then we're going to keep restrictions in place forever. And they come with costs. So, for example, if you keep social distancing in place, the hospitality industry cannot survive. So you would literally be putting thousands of businesses and hundreds of thousands of people out of work. And it isn't sustainable. We need a growing economy because we need to have tax revenue to pay for the National Health Service, to pay for research into long COVID and to help keep our public services running. And I'm afraid, given that this disease is going to be with us forever, as the Chief Scientific Advisor said, once you've reduced the risk hugely for serious disease and hospitalisation and death, which we've done and are doing through vaccination, then you have got to let people learn how to balance these risks themselves and get back to some level of normal, because otherwise you have a position which just isn't sustainable.
Because Professor...
I get that with wearing masks. With the social distancing. But wearing masks does not impact on the economy.
In a nightclub? At a concert, it does. I mean, the stats which your group, Mark Harper, fought very hard to get released publicly showed very clearly, didn't they, that people just will not go to these hospitality venues and events if they are going to have to keep wearing masks.
Well, the interesting thing from that events research programme, and we did fight very hard for that, and the government, for some reason, was extraordinarily not wanting to publish it. What it showed was actually people attending all of these events, there was very little transmission at these events, very low risks, and the people that run those events, the key things are about ventilation, the key things are about how you manage people in those settings. And these businesses have been working on this for the last 15 months and know how to do it safely.
Yes, well, they were all tested. They had no evidence of infection. And you bring a whole load of people together when there's no evidence of infection and you're not going to see transmission. But now we're opening up the nightclubs and we're going to say, oh, well, we'd like you to show your COVID pass, but there's no way of forcing that. There's no reason at all.
And there shouldn't be those.
Oh, well, that's my personal data. I'm not sharing it.
Well, no, and nightclubs are...
They'll probably let them in still.
Well, nightclubs, I don't know about whether it's changed in the last 30 years, but certainly when I was a young person, I didn't really like them then. But when I went to them, they're largely populated by young people. So they're populated largely by people who are at very low risk of being seriously ill or dying from COVID. So I just think
this is my point. The young people haven't fully engaged in the vaccination program.
Because they're at very low risk.
Some of them haven't bothered with it. They've heard all these horror stories. Oh, it's going to make me magnetic if I get vaccinated, or I'm going to be tracked and things like that. So a lot of them are not engaging with it. And so basically you're bringing together a lot of people that might be partly vaccinated or totally unvaccinated. And we've still got a huge amount of community transmission going on. And so that graph is just going to go exponentially through the roof.
So, Professor Cutler, can I just ask on a practical level, because you're going to have people, including young people who go to nightclubs watching this right now, saying, what does the professor want me to do? I mean, are you saying don't embrace these freedoms which the government are legally handing back to you on Monday? Are you saying if you go to a nightclub, continue to practice social distancing or to continue to wear a mask inside the nightclub? Practically, what's your message to people?
Actually, as Mark just said, that sort of testing before people go to the venue, do a lateral flow test or something like that. Stick a swab up your nose and to the back of your throat. Test yourself. And if you know you're not actually infected at that point in time, then you'll be safe to put in close proximity with others, even if you take your mask off.
I know, but that only works if everyone in the nightclub is doing it, Professor. I'm talking about people who are having to make personal decisions about what they do from Monday.
And I think those personal decisions have to really embrace the controls that we have. So if you are in an area that's poorly ventilated, you've got close proximity with others, do as Chris Whitty was saying, wear a mask.
So like a nightclub. So just to clarify, you're telling young people to continue to wear masks in nightclubs?
In close proximity, it's safer. The other alternatives are you test yourself and you make sure you're negative. Hopefully, you engage in the vaccination program as well. So it's using safe precautions. But to drop all the precautions in one go is just like...
It's not one go, though, is it, Mark Harper? There's been a slow
I was going to
release.
say, let me just pick that point up. That we've been in this particular lockdown now since January the 6th, when Parliament supported it, and the government published the roadmap in February. And since March the 8th, we've gradually been reducing restrictions. We had kids back at school in March, and each step we've been reducing restrictions. So the idea that somehow we're getting rid of everything all in one go, from lots of restrictions to no restrictions next Monday, is just simply not true. We've been gradually doing it since March over quite a long period of time. So by the time we finish...
6 months.
On the 19th of March, it's over 6 months.
We have been listening to data, but now we seem to have done a reversal, and now we're going with dates. And, whoa, schools are breaking up. 19th of July is coming. Let's go with the date. Let's go with this fire break of the summer holidays. So,
but I listened very carefully, Professor Cutler, to Chris Whitty today, who made the point that actually they had modelled all of the different dates and all of them end up with a very similar eventuality. So it comes back to the point that Mark made right at the start of this debate in the clash today. Either restrictions continue forever or we embrace freedom at a safe time to do so. And it's a safe time to do so because it's the middle of summer. There's the so-called fire break of the schools going on holiday. And actually, that makes sense practically.
I'm just saying we take our foot off the brake slowly and not totally take it off as quickly as they're wanting to do.
OK. Well, look, fascinating.
Of course, we do have our wonderful track and trace system, and we're keeping that. Although the idea is now, because it keeps pinging people too often, that we have to reduce its sensitivity. And yet, when you look at the data, we've got the Delta variant that's even more transmissible than the variant.
OK, so you say track and trace should stay. Mark Harper, final word on that?
Well, certainly people who test positive should isolate. But when you're looking at contacts, if you've been fully vaccinated, the chances of you getting the disease are reduced by 80%. So you have to reflect that in how the contact tracing system works. Otherwise, you're simply just going to have everyone isolating for no practical purpose.
As I was saying earlier this evening, a quarter of people that are vaccinated can still get infected. You may not get serious disease consequences, but you can still get infected. You can still pass that infection on to other people.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.